Get full episodes of The Damage Report as a podcast on iTunes and Android, and you can watch the live show every weekday on YouTube TV. The White House decided that, like with all Republican candidates these days, they are going to attempt to take down single-payer health care. They are going to attempt to take down Medicare for all because they are terrified that this idea is starting to get traction, starting to be more popular, not just amongst progressives, but amongst Republicans as well. And so the White House released a paper titled "The Opportunity Costs of Socialism," which is just, that's amazing. And they put out this chart. So let's put this chart up. I apologize, maybe you can split screen because that's gonna need to be up for a little bit. So seniors who waited at least 4 weeks to see a specialist during the past 2 years. So the longer your bar for your country is, that's a bad thing. So in Canada, if nearly 60% of seniors had to wait at least 4 weeks to see a specialist during the past 2 years, that would be considered a bad thing. And since all of those countries have one form or another of single payer healthcare, and then at the bottom, it says the United States is just 21%, then the idea is, look at all these socialist countries. They're terrible at healthcare, everybody's gotta wait. Not here in the US, our seniors don't have to wait as long while they're using their Medicare, which is government-run single-payer healthcare. What are you even trying to say here? What you're apparently showing is that the very program that we progressives want to expand and make available to everyone is not only single payer like these other countries, but is a better, more effective model for it. And we want to massively fund it even more and provide access to it to more and more people. So look, it's not like they're not gonna have some sort of follow-up to that, I guess, but they have no idea, I guess it's over here. This chart right here, they don't even know what it is that they're saying. They think they've got a point because some bar is long, some bar is short.
That's all it takes.
But you dummy, you don't even know what you're saying.
That's all it takes. No, colorful bars. And then so people won't read the titling, won't read the figures, won't read anything about it except for, ooh, Canada long bar, ooh, America short bar. That's all there is to it. So outside of that also, we have a healthcare system where I've always said this before. We like to brag about how awesome we are. Oh, we put money into something. We flood money to our military, and we're the best in the world. Nobody can touch us. How is it we're so whack at this? We openly admit, hey, we're horrible at healthcare. We can't do anything right. Look at these other countries. I thought we don't compare ourselves to other countries and talk about how they're doing something and we can't do it. Hey, if they're doing it wrong, I bet who us pompous Americans can think, hey, we can do that right. Hey, other countries have guns and tanks and start wars. We're better at them at it, aren't we? We like to brag about how if we flood enough money at something, we can do it better because we're smarter, we're quicker, and we're the most powerful. Why is this something that we just throw the white flag in at? Why is that the mindset?
I don't understand it, especially considering the stakes. But in terms of that chart where they inadvertently compare our single-payer healthcare to other countries' single-payer healthcare, well then a right-winger might say, oh, I'm kind of worried about that. So what do I go to then? Well, okay, so that's just the seniors, but what about everybody? Since everybody doesn't use Medicare, most people actually in America use private health insurance. So okay, we'll use that data, and that will make us look better than those damn socialists over in Europe. Well, it turns out when you look at that data, the picture is, I will say, mixed at best, if not in the favor of some of these countries. So I'm not gonna compare us to Switzerland or Netherlands or Germany that have better numbers in the chart that the White House provided. I'm gonna compare us to the best case scenario for the White House here, which is Canada, which was doing the worst in the information they provided. Okay, well when you don't just look at seniors, when you look at all Americans, 51% of Americans say they are able to get a same-day appointment with a doctor when they're sick, compared to 43% of Canadians, almost as many, and 57% of Brits. So the worst case scenario has close to the same ability to get in the doctor's office on the same day, and the Brits, which also have single-payer healthcare, actually find it to be easier in the opposite direction. If we could go to one other, Canada does better than the United States when it comes to access to after-hour care as well. 63% of Canadians say it's easy to access after-hours care compared to 51% of Americans. And again, that is apparently the country that does it worst, at least according to the White House. Now, they didn't provide that information. You have to actually go looking for that information. They don't want any part of that information, but it seems like kind of relevant information, doesn't it? Jesus
You would think so. Hey, all the relevant information just goes by the wayside. Who cares about that part? Let's just say, let's nitpick and see what we want out of it to continue this false narrative.
Oh my God, they're doing everything they can to demonize socialized health, socialized medicine, socialism, Venezuela. Like, they'll throw these words out. They are gonna get hit so hard by how much Americans want this program. It is gonna make their head spin, and it might not stop spinning until Bernie Sanders finishes his second term.
As more information comes out, you get a chance to see what other options there are. People didn't really know. They're like, oh, America's the best at this, and
well, they were told it was crazy.
Yeah.
But now they're being told by some people, maybe not so crazy. Thank you very much for watching this clip from The Damage Report. If you liked it, don't forget to subscribe to this channel and ring the bell on YouTube to get notifications of our new videos. And of course, you can catch the full Damage Report live every weekday at 1 p.m. Eastern, 10 a.m. Pacific on TYT Network on YouTube TV.